Before I begin, I want to show my sincere appreciation to these wonderful people who have contributed greatly to my knowledge. So today we'll discuss a series on image artifacts in ultrasound. So we will begin our discussion from here, and I'm sure we'll be able to do an exhaustive study of artifacts in ultrasound. Now, what is artifact? What does the term mean? Ultrasound imaging artifacts are echoes on a display that do not represent the real anatomy that is being imaged. Ultrasound images are commonly filled with different types of artifacts and can be particularly troublesome in ultrasonography. Some artifacts are helpful in diagnosis. For example, posterior acoustic enhancement, or what we call through transmission, helps to identify a cystic structure. Posterior shadowing helps to identify a highly attenuating structure like bone or stone or calcification. So some of the artifacts are hindrance. So these ones that I talked about are helpful, but the ones that are hindrance to the diagnostic diagnosis is example like reverberation artifact, slice thickness artifact. Now it is important to recognize artifacts and appreciate their significance, and thus avoid potentially important diagnostic error. Only appropriate education and experience can alert the operator to the possibility and recognition of artifacts. What the sonologist must understand is that they must understand the physical properties responsible for various artifacts. The sonologist must or should be able to recognize them to avoid misinterpretation, and the sonologist must also be able to try and avoid them whenever it is possible. Now let's talk about basic assumptions in ultrasound. The ultrasound system, like I've discussed in other classes, works on based on certain assumptions about the way sound interacts with tissues. However, these assumptions are often contradicted by the way in which the sound beam actually behaves in tissue. This results in error in the presentation of each echo information on display. So these assumptions includes one, sound travels only in a straight line, and that assumption is not true, because in reality sound may be refracted or deflected in a different direction before returning to the transducer. Number two assumption, echoes originate only from the object located along the central beam axis. That assumption also is not true. Echoes may originate from anywhere in the beam cross-section, including the edge of the beam. Echoes may also originate from side lobes. Number three assumption, amplitude of returning echo is directly related to the percentage of reflection or reflection amplitude of the reflector. That is not always true. The amplitude of echoes at the transducer may be affected by several factors such as angle, attenuation, wave interference. Assumption number four, reflector distance is proportional to the go-return time of about 13 microseconds per centimeter. That assumption is not true. The go-return time may be longer or shorter than the normal, depending on the actual velocity of sound in the medium. Now, having understand that, all these assumptions is basically what the machine was created with, but they are not always true. So, having understand that, let's classify artifacts. So, we're going to classify artifacts according to their effects on the display. Echoes are added to the display in some cases. Now, these are echoes in the display that do not represent actual interface in the scan structure. They are not real anatomy, but they appear there by reason of those assumptions that were not met. Echoes missing, we can classify artifacts based on echoes missing from the display. Now, these are echoes that should be displayed but are not. For example, in other words, they are missing. Yeah. Number 3, effects on display of artifacts. There are echoes that are improperly located. And these are real echoes that are seen in the display, but they appear in different locations, like you find in the misregistration artifact. 4, echoes of improper brightness, echoes of poor or improper shape or size. So, we also will classify artifacts according to their underlying cause. What is causing the artifact? In other words, the mechanism of their propagation. So in the first instance, attenuation artifact is usually related to attenuation of sound by the medium. Number 2, propagation speed artifact is related with the velocity of sound in the medium. And the third instance is electronic noise, oblique incident, clutter, as you see in Doppler. Some artifacts may occur by improper control settings. Like, in other words, they are operator induced or due to equipment malfunction. And these kind of artifacts are due to improper TGC setting, improper gain setting, improper focus setting, and so on. So the following is a list of most common artifacts with an explanation of the cause and the results they have on the display. So the first one we'll look at is interaction of sound with tissues. And in this case, you have reverberation artifacts, where you have multiple reflections. And the list for reverberation artifacts include ring down artifacts, comet tail artifacts, multipath reflections, mirror image, what you call ghost image, and mirror image on Doppler. Now, refraction artifacts includes edge effect, that is refraction and total internal reflection. Refraction artifact also includes split image artifact or refraction duplication artifact. Now, attenuation artifact includes posterior acoustic shadowing, acoustic enhancement, or what you call through transmission. Then you have the electronic processing artifact. Here you have the acoustic enhancement or through transmission. You have signal amplification artifact. Some will call it ballooning effect. And there is the electronic noise. Now, signal processing includes slice thickness, beam width artifact, side lobes, transducer resolution, spatial. Transducer resolution includes spatial, axial, and lateral resolution. Then we have focal zone under signal processing. Then there is the misregistration error, and which include propagation speed error or velocity artifact, and range ambiguity artifact, which only will occur with continuous wave Doppler. Now, the operator-induced artifacts is actually associated with improper gain, improper TGC, and improper focus setting. Now, what about artifacts associated with spectra and color flow Doppler instruments? It includes aliasing, ghosting or flash artifact, range ambiguity, and range ambiguity is actually misregistration. You have a clutter, you have color twinkle artifact, there is slice thickness, reverberation, incident beam, angle, etc. Now let's look at reverberation artifacts. Now, it's an echo which is received several times by the transducer. It is also called multiple reflection. Reverberation artifact is seen as multiple or equal spaced. They are equal space artifacts, and they are multiple. They are linear echoes, whether step ladder like pattern, and they are decreasing in size and intensity. That's the way you get to see it. Reverberation is caused by echoes that is bouncing back and forth between two strong interface or reflectors. It occurs when the echo bounces back and forth between the transducer and the surface and a strong interface until all the energy of the sound being waned out or is attenuated. Now, this belongs to the time of light producing an artifact deep in the interface. But in this situation, some of the sound returning to the transducer is reflected back into the patient, and that pulse strike the same interface in the patient and is reflected back to the transducer a second time, and so on and so forth until the total sound energy wanes out. Now, the first reverberation artifact is therefore twice as far as the skin surface as the original interface was from the transducer. So similarly, the second and even the third or more reverberation artifact can occur until the energy in the ultrasound pulse weaks and it becomes too weak to be detected. So all these are spaced equally to the distance from the actual interface. Now, the first echo display is real, but all the subsequent echoes received from the same reflector result in additional echoes being displayed which are not real. Now, since each successive reverberative echo takes longer to be detected by the transducer, it is displayed deeper in the image. This phenomenon occurs when the sound beam is perpendicular to a strong reflector, such as a soft tissue to air interface or abdominal wall deep to a considerable depth of subcutaneous adipose tissue. You can also have that in gas-containing structures because they are strong reflectors also. Reverberation artifact is often seen at the edge of the image in the near field due to poor contact between the transducer and the skin. Now, ring-down artifacts. Ring-down artifact is a phenomenon that occurs when the air or gas is suspended in a fluid medium. It appears as a line or uninterrupted echo in the direction of the sound beam and deep to a strong reflector. Commonly, it is seen deep to a collection of gas in the stomach and duodenum. It can also be seen in gas-forming abscess or posterior to air in the biliary tract. Because it is caused by air bubbles, it is usually transient. Now, ring down artifacts cannot be eliminated, but can be decreased by decreasing the overall gain. The comet tail artifact is a type of short-range reverberation artifact that occurs from closely spaced surface of small but strongly reflective objects like a tiny gas bubble, a piece of metal in the body such as surgical clips, IUCD, or lead shots. Some pigment cholesterol stones, usually in the wall of the gallbladder, will produce comet tail artifact, or colloid material in the thyroid nodule. Now, it is seen as a highly echogenic narrow column of closely spaced reverberation echo arising from the posterior surface of the reflector. Now, those echoes are constant and will be seen in all subsequent scans. The mechanism is the same as the reverberative artifact, with only difference being the close proximity of the two reflectors. Besides, the theory of the reverberating back and forth, a more plausible explanation, however, is equivalent to the ringing of a bell. The sound pulse insonates gas bubble or metal will cause it to ring. But interestingly, the artifact does not occur deep to the calcification or calculi. The plate-like cholesterol crystal probably are oriented perpendicular to the beam to cause the ringing, because both the comet tail and the ring down artifact produce a streak of bright echoes, and many authors mistook the comet tail for ring down and vice versa. You will not blame them. There's no one expert sonographer anywhere, so it can be mistaken, but the two are actually distinct. They are produced by different phenomena and have different appearances. Ring down is only seen behind gas and usually extend deeper on the screen. Comet tail can also be seen behind gas, but is also seen behind metal and cholesterol crystals. Comet tail is much more shorter and is V-shaped. Yeah? Then multiple path artifacts. It describes a situation in which the path of the pulse and the path of the returning echo are different. It usually occurs where there are highly curved strong specular reflectors such as diaphragm or urinary bladder that is full with urine. Two or more different returning sound beams from the real structure that differs in path and length, will emanate. The false image is located usually deeper than the real structure. These multi-part artifacts behind the urinary bladder can be mistaken for a pelvic mass, especially if you are new in the art of scanning, or you don't understand artifacts. The sonologist can prove that the mass is truly an artifact by scanning it from different angles to see if it is maintained. Also, scanning after the patient partially void and observe if the mass change is in size in accordance with the bladder size change. The mirror image artifact is another most common example of multipath reverberation artifact. The mirror image artifact is a ghost image of a real structure appearing in another path of the ultrasound image. The ghost image is typically seen above the diaphragm. A cystic or solid lesion in the liver or spleen parenchyma that is close to the diaphragm may produce a mirror image above the diaphragm, and is one of the most common findings. So to help determine whether this lesion is real or not, the following factor can be considered. Mirror images are created equidistant from and on the opposite side of the diaphragm from the real echo or lesion. This artifact can be minimized by decreasing the overall gain. The mirror image will be a replica of the infradiaphragmatic lesion. Mirror image in Doppler. Here you have air in the apex of the lung can produce a mirror image artifact of the subclavian artery, in which not only are the grayscale echo duplicated, but also the Doppler shift flow echoes from the blood. Now the result is an artifactual duplication of subclavian artery that is deep to the original. It's actually a complete duplication of Doppler as well. The vascular sonologists have to be careful to recognize these artifacts when scanning the subclavian artery just inferior to the clavicle. Side lobe artifacts. Now, all modern transducer emits a main beam as well as several secondary beams which are directed on all sides of the beam. There are two types of secondary beams, namely side lobe and the grating lobes. The side lobes are secondary beams that travel in a direction that is different from the main beam. They are produced by almost all transducers, while grating lobes are a second type of secondary beam that is emitted by only by array. Now, array produces grating lobe due to the geometric arrangement of the small crystal element in these transducers. Side lobes and grating lobes are typically 20 decibels less intense or 100 times weaker than the main beam, but can produce weak artifact echoes which may be written in the ultrasound image. Although the sound beam is displayed on the image as a narrow vector, the beam is at least several millimeters wide in the focal zone and even wider in the near and far zones. The intensity is higher in the center of the beam, decreasing towards the periphery. The periphery of the sound beam, which is a side lobe, can be reflected by adjacent highly specular curve reflectors. Now, when the center of the beam is aimed besides a strong reflector, an off-axis echo can be displayed along the vector representing the center of the beam. Now, side lobes of the main beam can cause echoes to appear from structures as much as 45 degrees away from the central vector. The side lobes artifacts are common with all modern transducers, but much more likely to occur with phase array, curvilinear array transducers. But fortunately, they are usually differentiated from real echoes and or septations. Then there is the attenuation artifact. Now, the intensity of an echo is determined not only by the strength of the reflection, but also by the acoustic characteristics of the tissue between the transducer and the interface. Now, the sound travels through the intervening tissue on the way down to the interface, and the returning echo must also traverse the same tissue. Now, the intervening tissue may attenuate the beam producing the acoustic shadow, or appears to enhance the intensity of the returning echo showing through transmission. Acoustic shadowing. An acoustic shadow is an absence of echoes posterior to strongly reflecting or highly attenuating structures, deep to gallstone, for example. The sound beam does not reach the deeper tissue to produce an echo, so complete shadowing does not cause confusion and can be helpful in confirming maybe a gallstone or a renal stone. In fact, shadowing helps in the diagnosis of a stone, of calcification or bone or prosthetic material. So this type of artifact is a useful artifact. But in some situations, a shadow may not be complete deep to a stone. This is due to the width of the beam relative to the diameter of the calculus. So when the calculus is smaller than the beam width, an echo is received from the calculus, but some of the sound goes around the stone with echoes returning from the deeper structures. So you don't get to have a shadow, so there may be no shadow at all. It is important to use the appropriate transducer and to adjust the focus to the depths of the stone to appreciate the shadow. Focusing will play an important role in production of acoustic shadowing. Now you have a dirty acoustic shadow. Now soft gas interface are also highly attenuating and may produce acoustic shadow, but usually not as clean as stone or calcification. They are termed as dirty acoustic shadow or amorphous cloud. So I want to thank you for joining this lecture today. Please like, share, subscribe, and put on notification to receive all our free lectures. For more information about our paid classes, please send an email to sonographers@gmail.com or WhatsApp me at +234 9019 144 175, or you can visit our online store at sonoeyes.business.site. Attend the quiz in the description and leave me a comment. Until the next time when I come your way again, keep learning ultrasound.